I'm Dr. Angie Stamm.
And I'm Kayla McGuire.
And this is Integrative Connections, a wellness community for pets and people.
Well, welcome to Integrative Connections podcast. I'm Dr. Angie Stamm, and today we are interviewing Kirk Hamilton, PA. I actually recently met Kirk because he treated my good friend who had a stroke, and she was going to him for post-stroke support. And I was happy to meet him, and turned out he had a lot to share with us. So we are here today to talk about several of his favorite topics: pain management, dementia support, COVID-related syndrome support, and repurposed drugs for cancer. Those are kind of the topics that we're going to cover today.
Great.
So can you just tell us, before we start, a little bit about your background and where you're at today?
So I was in our day in UC Davis. I graduated with a Bachelor of Science degree there in sociobiology. I mixed science and social programs, and I was an ambulance person, an EMT1 there, and then I became an EMT2. They didn't even have paramedics in that day. They didn't even have them in Sacramento, 1983, or late 80s. So I got to know about hospitals a lot because we hung out, a little community hospital, Davis Community Hospital, and so I felt very comfortable. So, you know, the PA world is either, I'm a learner by doing, I'm not a learner by sitting and reading and, studying books and regurgitating stuff. So PA program is good for me because there's clinical and didactic, and they mix them together, and that's how you learn. When I went through the PA program, there was some things on alternative medicine, and it was more mind-body stress reduction, and it opened my mind up to start reading about alternative therapy. So by the time I came out, it was either emergency medicine, because that was what I was used to, or this integrative preventive medicine then. And so I applied to 250 preventive medicine nutrition practices of doctors up and down the West Coast, got 4 replies, and the one that I stayed with was in Marina Del Rey, California. And probably that's where I got 2 of the biggest learning lessons. So I practiced there for 6 months, drove up, see my baby was born up in Sacramento. Once a week I'd go up the Pacific Coast Highway. And but I stayed there 6 months, but there was 2 huge lessons there. That one, everybody got put on a vegetable puree there. So they got off all the normal foods they ate. And he called it a detox. And basically it was kind of a green drink, okay? And I saw every symptom improve when people got off the foods they normally eat. I mean, you name it. Arthritis, migraine headaches, inflammatory bowel disease. So that was bang. Food makes a difference. Sure. And I've kept that in my pocket. To this day, it's still probably the most important thing. You've got to get off foods you normally eat and see what happens. And there's some biggies that everybody tends to eat. Right. So that was one thing. And the second part there is he threw some audio tapes down called Preventive Medicine Update by Jeffrey Bland, who started the whole functional medicine movement. He was a biochemist at the University of Puget Sound. And so there's these hardcore tapes that reviewed nutritional biochemistry and was trying to bring them to doctors. Now we're in in the early 80s. There's only like 12 nutritional companies at that time, mom and poppers.
Yeah.
And so that got me started, and I bounced around to different practices because as a PA, you have to use a doctor's license to practice medicine.
You have to work under an MD
right.
or a DO.
And so everybody thought that they could do preventive medicine, but they really didn't. So you get a specialty like a GYN or a psychiatrist or whatever, but it didn't work because you have to have the whole practice in that kind of thought frame. So at one point I was being supervised by a physician down in the Bay Area, and I had a clinic close to where I am now, like one hall away down. And then Dr. Quaker came over, who'd been working a long time in alternative medicine. He's an osteopath. And
he's out of Sacramento.
Correct. So he moved over because he saw the building, and 6 months later, in July of 1986, I started working in Health Associates Medical Group with him, and I've been with them ever since.
Okay, great. So you've been Sacramento-based for decades.
Decades, and we're just integrative medicine, preventive medicine, whatever you want to call it. And him and I have been there almost the whole time, and then we have a female PA who works there and does a lot of female medicine, very successful at it. And so we're a low-key practice. I mean, in the sense of, we're not a fancy practice. We're just, people come and from all over.
Kind of GP, if you will. Yeah, integrative GP.
He has a different style. I mean, he's a homeopathist. I mean, he likes homeopathy. He loves a blood type diet, and he does those things really well, and he does some IVs and things like that. And I'm more of I do a lot of assessment and testing, and you ask about vitamins and minerals and So I tend to test a lot.
Okay.
Because I want to kind of prove why I do stuff.
But you treat everything from cancer to psychiatric issues to GI.
Yeah, everything. I can't think of a thing that we don't treat.
Okay.
You know, and then you kind of flow with
musculoskeletal, sports injuries, etc.
Yeah.
Great.
So that ends up.
And you've written a book.
Yeah. So I wrote a book in 2011. It's called "Staying Healthy in the Fast Lane," and it was my. Well, actually, I had a publishing business before that. So when I got into this, you know, wow, there's nutritional biochemistry that supports this stuff. I started a service called Clinical Pearls. And a lot of the early alternative doctors subscribed to it. So I would summarize nutrition research, but only from peer-reviewed journals. So none of it was from alternative journals. Because we were all like getting, you know, you get attacked, you're a quack, you're this, you're that. And so I said, man, there's real stuff. And that came from that base from Jeff Bland. But I started to do it. I had a service from 1987 to 2016. And kind of labor of love, you know. But I also did interviews. So I did 1,200 interviews that are still on the internet.
You did, and you had podcast?
Yeah. So then I started to do podcasts, and I got very much into plant-based diets because I was a vegan for 25 years. Okay. And so my podcast started off with the big people in that realm and the science behind it. But then I branched out, and then you know COVID came, and that I was somebody who, after I got COVID, I'd been studying early treatments. The controversy there. I mean, it wasn't controversial to me, but it was controversial to the outside world. And so fortunately, my supervising physician said, go ahead, do it, go for it. So after I got COVID in August of 21, treated myself, following Peter McCullough's protocols and the FLCC.
Yeah, so let's segue into that because that's one of our topics anyway.
Right.
So you went ahead and so you were treating during the COVID days using McCullough's protocols.
Combination of McCullough and
Ivermectin.
Well,
vitamin C, vitamin D.
Right. So really, you know, when you think about this, all could have been prevented if we did aggressive nasal washes with
iodine nasal,
and hydrogen peroxide and stuff like that. Because poor countries did it. That couldn't get the vaccine.
So that's the best preventative.
Yeah, you want to jump on it early because the virus would replicate up here and before it would go down into the lungs. If you could catch it up there, so if everybody would have been vitamin D adequate, had above 50 nanograms per ml. And done the washes right away.
It would have been a non-issue.
Yeah, and then you put a little ivermectin in there if you want, or hydroxychloroquine if you want. I mean, I would add C and quercetin and zinc. You know, you can keep adding but that core, if you could do it quickly enough. But what would happen is because everybody no traditional areas were treating. Yeah. You know, we can talk about big HMOs in the area, but we get people who are just said, go home and wait till you can't breathe. I mean, I'm serious. Wow. And so again, we didn't bring them into the clinic. So because we had different belief systems in the clinic, just like families have different beliefs about COVID. I mean, you know, and so. So
you're treating via telemedicine primarily?
Yeah, by phone. Yeah. So that was some of the hairiest times as far as like. So first of all, I'm doing more drugs than I've ever used. So if you follow McCullough protocol, you could have somebody on ivermectin, you could have them on zithromycin, you could have them on doxycycline, you can have them on prednisone, you can have budesonide, because you're trying to treat the three phases of COVID, which is the viral phase, an inflammatory phase, and then the clotting phase. And the clotting phase is what kill people. If you didn't do anything, then these cytokines and things and the spike protein and stuff, which cause microclots. And that's what people died of, microclots in the lungs.
Right. And that's what we're still dealing with today is the residual hypercoagulation issues from the spike protein, whether it's natural infection or vaccine.
The problem, yes. So the problem is normally the spike protein in the infection, and I can measure them. I measure the spike protein antibodies now. We don't have it'll come. There'll be a direct measurement of the spike protein soon, but we measure spike protein antibodies, the quantitative amount. So what you'll see in a natural infection will go up and it'll come down. That's normal. If you got a vaccine, and I see this because I treat vaccine injury and long haul, so I do spike protein antibodies on almost everybody now. Okay. And you'll see, like mine are elevated. I had 2 injections. Okay. Regret it, but It's all right. I did it and I learned a lot. Yeah. But I have patients like I've had 3 or 4 and they'll be in the 20,000s. So like the normal range is like less than 0.8. Okay. And the McCullough protocol, he'll want you to get, as you're treating people for the spike protein and post-COVID syndrome and injury and stuff like that, you're trying to get that spike protein below 1,000.
Okay, and that's possible even in the vaccine, even in people who have been multiple vaccines, you can still get their levels down.
That's the $74 million question, because not a lot of docs are measuring these. Okay, so and his protocol, he's got the spike protein detox, which is bromelain and curcumin and nattokinase. But you can do it by modified fasting and a variety of other things. But they do correlate with the amount of vaccines, because I'm starting to get a feel for it. So I had, some people are very pro-vaccine and they've come in and they're foggy brained and weak and whatever. And you do them like I have something in 26,000s. Wow. And you'll say less than 0.8, but the goal, he believes, this is Dr. McCullough, that if you get below 1,000, that's pretty good. You're moving it down the chain. Okay. So I do that. And we do a variety of supplements, but those 3 core ones, the nattokinase, the curcumin, and bromelain, are the core. But I'm going to add some other things to that, obviously. And you follow them, and then I would throw in. Now we've kind of jumped into treating post-COVID, but I think it's a perfect segue. Yeah. I would add on to that ivermectin. Yep. So I'm a big fan of ivermectin because I've taken it myself for cancer. Okay. Which is another story in the curveball here. Yeah. But it's very safe. And it has a multitude of effects. One is anti-inflammatory. So a lot of these symptoms that people have are just the spike protein wreaks havoc. And so the problem with the spike protein, that the mRNA vaccine tells your body to make the spike protein. That's all it did. It didn't tell you to make the ball, which is the nucleocapsid. So the spike is what it made. And that's why it didn't work, because it only made, and it was the old spike protein. So you're always...
Not the mutated version.
Yeah, but you would always be chasing it. You're never caught up to a new vaccine is not cut up to the new variant. Right. It can't do it. But also you never did it to the main thing. So it's not like you took a virus, chopped it up, the whole thing, and threw it in your arm and got a shot. That's kind of old school. Right. The problem with it is the vaccine goes in, with the lipid nanoparticles, goes everywhere. Brain, ovaries, and we don't know how long that the machinery will be making it.
Could be forever.
That's correct. So that, even though I had 2 of the vaccines early and I didn't have bad reactions and I treated myself with COVID and such, there are people who believe that there are things called turbo cancers. Mm-hmm. So mortality rates, life insurance companies have found that mortality rates since the vaccine came have gone up 10 to 40% in industrialized countries who take it. Mm-hmm. It was a life insurance. People go, like a 10% rise is like something you see every 200 years.
Right. I've heard this. Right. And cancers and strokes.
Right. And so, we talked about Dr. Mackus, the radiation oncologist from Canada, and I started following him on the Substack because he was following these groups of people who, doctors were dropping, young Canadian physicians. So they were more strict in Canada with vaccines. And then he would do nursing groups, and he would do, pilots and then football players. And you'd see, wow. And I go, I'm going to follow this, because I was writing and sending it out in my newsletter, and then he evolved into post-COVID treatment. And this is where the whole ivermectin thing for cancer, and we're going to get into that, but this kind of flows into it. Mm-hmm. We found out that it did help COVID, okay? But it's not the only thing you could use. There was times where I used more drugs treating COVID than I used in my whole 40 years.
Yeah, so do you think with respect to the ivermectin in post-COVID syndrome, do you think it's acting more as an anti-inflammatory in that realm?
And if there's any, but if there's any, because not, some people are vaccinated, some people aren't. If they're vaccinated, then maybe it's having some kind of antiviral effect, but it seems to bring it down, in my opinion. Now, and it seems to help with symptoms. So I always do just a therapeutic trial. Anybody comes in post-COVID syndrome or vaccine.
And is that going to be like at the 0.5 mg per kg dose typically?
No, so I'm more aggressive, but I didn't start that way. I started it, using the FLCC protocols of, first it was 0.2 to treat, milligrams per kilogram, then went to 0.6 milligrams per kilogram, and then you could just see them kind of, as I'd go to the conferences, kind of increase. But the cancer treatment dose
is 1 mg per kg.
So it's the starting dose is 1 milligram per kilogram. So I'll start at a 0.5 milligram per kilogram, see how you do, because you can have some visual disturbances sometimes with ivermectin. Right. And then go to 1 milligram per kilogram as a base treatment dose for cancer. And then you can go to 2 milligrams for aggressive and 2.5. Okay. So I've done that, and so getting back to, post-COVID syndrome or things, I feel more comfortable with higher doses is what I'm trying to say, because I've used them so much that it's very safe. And I've taken more than probably anybody on the planet as far as a high dose. No, truthfully, I
What dose have you taken?
Well, I don't mind. I mean, what happened is I started to taper up. So I had my colon cancer diagnosed in 9 of 23. September 26, 1923, and I had started on ivermectin because I'd taken it for prophylaxis after I had my illness because I was around people. I was treating people, and so I was around people, so I'd take 12 milligrams, small doses. But when I got the cancer and then I started reading, the doses kind of went up. So 1 milligram per kilogram would be about 70 milligrams for me. Right. Okay, that's before I lost all the weight, but I mean 70 milligrams. And so that was 1 milligram per kilogram. So I actually went up to 140 because my tumor...
140 milligrams.
Right. So my tumor was there. It was supposed to be, I didn't want to get it cut out. And I talked to the oncologist and the surgeon and my gastroenterologist. I said, listen, I want to try some of these things that I've been seeing. And so IV vitamin C we have in the clinic. So I could do that 2 or 3 times a week, 4 times a week, 25 to 50,000 milligrams a day. I could, I have access to that. So I did nutraceuticals. So I would do, there's a lot of nutraceuticals, but vitamin D, C, N-acetylcysteine, olive leaf extract, mushroom products, etc. And then the repurposed drugs. So is that triad.
Yes. So repurposing, meaning that you're using ivermectin, which is originally an antiparasitic for animals. Now it's found to have these antiviral, anti-cancer effects.
Because I'd used it.
Right. You felt comfortable.
Yeah. And so then the information just kind of like it just came. And what happened was at the conferences that we're talking about, the FLCC, now they've changed their name, but they went from like the first and second one were like, treating COVID post long haul and then vaccine injury. And then the last one I went to, it was a whole third of it was on cancer. And some of the docs were rethinking. And so there was a whole third of a section.
Interesting how the COVID sort of evolved into cancer treatment.
Correct. And then we started seeing more, cancers coming from the COVID people and the vaccine people.
Right.
Okay. So, and so it all came at one time for me. It's like, okay, so I was more aggressive with myself, and I didn't want to have it was a 6.4 centimeter mass, and I didn't want to have it cut out initially, and I wanted to see if I could shrink it, and it wasn't spread anywhere, and I didn't have a CEA that ever went up, so I worked on it a year and a half, and then I also did the mind-body stuff of Dr. Joe Dispenza as well, and I really believe that's the ultimate in healing, to be truthful.
Sure.
But you got to move your head there, and it's work.
Yeah.
It's not just a magic thing. So I was doing all those things, meditating 2 to 4 hours a day, doing IV vitamin C, and I tried different diets. So the theory is more of a ketogenic diet, starves the cancer cell because it doesn't give it sugar.
That's what we use in animals often too, in the integrative side.
And I lost so much weight though.
It was hard for you to maintain your weight on that?
Yeah, I used to be like 175 pounds. So now I'm 152 or 3, and this is good compared to, I got down to 138.
Yeah, on ketogenic.
Yeah, I couldn't, I was trying to work, and I was like, so just keep the sugars out of my diet, and so that didn't work for me. But I know that all the docs that do this, they're heavily into the ketogenic diet. Plus, so what the thing is, the theory is you starve the cancer cell, then you give a chemotherapy, which could be the ivermectin or the fenbendazole or limabendazole.
And those can be synergistic with traditional chemos as well.
Well, absolutely. So Dr. Mackes is a radiation oncologist, and so when you read his reports, and I always tell my patients, listen, you're going to spend thousands of dollars if you're going to treat this, alternatively. Spend $60 and get his newsletter, because then the paid Substack, because then you'll see the doses used, and you'll see cases every week of different cancers. Like 6 or 7 that he's treating and they're improving. And you can tell they're not fake because their email wipes the name out, and you see the scans. And so that's what I read that every single day.
Yeah.
Because I'm trying to get ballpark ideas and stuff. And the main drugs are fenbendazole, mebendazole, and ivermectin. It's usually ivermectin plus a combination of one of those two.
Mm-hmm. And the protocols are obviously still evolving.
Right, but those two are always there. And then there's usually CBD oil. There's he likes lactoferrin with the ivermectin, and so he gives the medicines and the nutraceuticals. So anyway, that's how I got more trusting in using the doses on myself. But I kind of went over the board because I'm laughing, and people are probably going, oh my God, like this guy's a nut. So I never want to see him, but that's fine. But so what happened was is that I tapered up, and so I got to that 2.5 milligram per kilogram dose, but I had 45 milligram pills. So normally when you buy overseas, it's 12 milligram tablets that you're buying. So you can go up in little smaller increments. And I was going back and forth on which one's better, and we had this conversation about some people believe if what comes from a compounding pharmacy comes from China, the source, that, do you trust that?
Right.
Okay, and that's all compounding pharmacies most of them get their ivermectin from a big chemical companies, which they get from China.
Got it.
Okay, so there was that debate, or you get it from India. So I had both, and I was going back and forth. So I'd actually do both at the same time, just adding up. But if I for whatever reason, I switched to just doing the compounding one for a while. But there are 45 milligram pills that I had. So when you go up, you're not going up in 12, you're going up a big chunk.
Yeah.
So I ended up getting up to 280 milligrams, which is 4.5 milligrams per kilogram.
Had no side effects from that.
So I eventually did. Okay, but I was on that for a while. I slowly did. I didn't do it overnight. Okay, this is over several months.
Go blind. You could still walk.
So I'll tell the story, and people that are listening to this are going to take it any way they want. People that say, using repurposed drugs is bad, they're going to take it one way. Sure. People that are going to say that, wow, that was a big dose and he didn't die. So what happened, and also I'm working really hard. Okay, so I've lost a lot of weight. I'm working really hard, and I was up to this dose and I was doing fine, and then I was, getting up at 4 a.m. and meditating for a couple hours before work, and I was trying to put it all together. Yeah. And there was one more repurposed drug that I was told by a physician that's tremendously great, very smart breast cancer specialist, and anyway, said try propanolol. And I go, God, my blood pressure's low right now, and
gonna make you even more.
And I have a slow heart rate anyway. Okay. So teeniest dose. So I did the teeniest dose just 2 days, and I had fasted. So fasting is part of this. I had fasted before this, so there's a couple of days after I ended the fast, and I just passed out.
Oof. So propanolol is a repurposed drug for cancer as well?
It was, yeah. I don't use it anymore, but it was part of, there's repurposed drugs. For example, the erectile dysfunction drugs are repurposed drugs for cancer. They help.
Really?
Yeah. Cialis does it. Not like ivermectin, so there's an echelon.
Okay.
Okay. But there's a whole echelon of pills that have anti-cancer effects in some part of the metabolism.
Interesting.
Yeah, so, Viagra.
Wow. So Viagra and Cialis can be pro-longevity drugs too.
Right. So you could be on, at one time, like, say, ivermectin and fenbendazole, and then you could take one of the Cialis. I did that. And then I was going to do metformin, keep your blood sugar low. Mm-hmm. My blood sugar got a little too low because I was like, I don't want to do that. So there's a variety. So that's why you got to follow people. But when I had this experience, it just happened to be, I don't know which combination it was, but I only took it 2 days and a very low dose of the propanolol, but I did it at the same time as I had the ivermectin at this large dose, and I was going to hold it there. And I had passed out and had to go to the emergency room and spend the night, and it's MRI, CT scans, everything was fine. So this is the part where you can take it either way.
Yeah.
He came, the intensivist in the hospital was very nice, and he just said, I think it was an ivermectin overdose.
Wow.
And, but I was fine. Sure. What I mean was the next day. But that day I wasn't fine. Couldn't rouse me. It wasn't pretty. And so you can make whatever you want of that. You know, to me, I mean, I would never I stay at the 2 milligram per kilogram dose when I have an aggressive cancer patient, 2.5 maybe. And that was way under what I was doing. Okay. So
but for people who want to learn more about the repurposed drugs for being used for cancer, William Makis, M-A-K-I-S, is kind of the authority right now. Well, one of the authorities.
And the FLCC, I forget the new name, but the FLCC puts out, you know, Dr. Paul Merrick. He's the second most published in all of critical care medicine. These are traditional doctors. These aren't alternative like me.
Right.
I mean, he put out, he has a book, an easy book on Amazon. It's on repurposed drugs and cancer. It's excellent. And he puts them in order, and they'll change a little bit probably over time.
Sure. So this is not really a new discovery, but it's gotten more press and more momentum since COVID, really, is what you're saying.
Yeah, and also before that, there was a Dr. Thomas Seyfried. He's a geneticist at one of the big institutions back east, and he's been studying the Warburg effect and adapted it. And he's the one that really, you can Google him on the internet and have an incredible hour lecture. Anybody can do it on metabolic treatment of cancer. And he'll get into detail about the ketosis and using drugs. When you have the person in ketosis, that's when you want to use the drugs, because the cancer cell is more susceptible.
Sure.
So he was before all this, he's been doing it.
So in the hierarchy of tools in your toolbox for integrative cancer treatment, with certainly repurposed drugs being way up there, I know you guys use IV vitamin C. Do you use ozone?
No, I don't, because we didn't. I know the doctor where you studied, Schellenberger. You know, he's the godfather of
the ozone. Yes,
ozone. But you have to do a therapy. So here's another thing about a clinic: there are a million therapies you could do, but you have to do something enough.
You have to master your protocol.
Right. I have to do something enough to feel comfortable with it enough that I know what I can tell people is going to happen from it.
Yep.
Okay, and you can't, I mean, you could do everything, but I can't do everything. I don't want to just offer it just because it's out there.
Sure.
So I can tell you a lot about vitamin C, because when I had adult chickenpox at age 28, when I first started working there, I took 80,000 milligrams IV for a week. I mean, I had cystic acne from here, it looked like, to my groin. Wow. I mean, it was, and I've never been so sick.
Terrible.
And so I took that and took about 40,000 orally, and so that was my early vitamin C experience. But so I have a familiarity with it, and I know when to pull back and such. But I can't get great at everything, and plus a clinic can't. I mean, unless they have a whole section that does that all the time.
Sure, it takes a lot of labor.
So clinic and I might not be organized that way. So we tried a little ozone for a while, but we just didn't do a lot of it. You know, we're our basic vitamin C infusions with multivitamins and B vitamin shots. We have people take them home. We do glutathione for certain things. It can help with cognition, but it's not as lasting. You know, it can do it for a while. You know, it was noted for Parkinson's disease. That was the classic reason to use it. And people would walk well, and you'd see them give it, and then, it'd come back. So we use it in addition to, but I would say probably the thing I use the most is, 25,000 of IV vitamin C, though we go up to 75 or 100.
Mm-hmm. And you'll do that like weekly for your cancer patients typically?
Well, I mean, it's a pocketbook issue because it costs money.
Yeah, and time.
Right. So in my case, I mean, I did it, ideally you do it 2, 3, 4 times a week.
Right.
Okay, and I could do that. So in my case, a year and a half later, the cancer had grown a little bit, but it never ruptured my intestines, which was the big fear, because that can kill you, not the cancer, but you can. And it didn't spread anywhere. CEA never went up, and so finally I just got to a point where I needed to get it out.
Yeah.
And so I chose not to do chemotherapy. So I'm staying on the lower doses of those repurposed drugs and the nutraceuticals that I was due for treatment. You can get IV vitamin C once a week or maybe twice a week instead of 3 to 4 times a week. And
sure. And you're doing some intermittent fasting potential, or some fasting ketosis?
Yeah, I'm trying to, but I'm trying to gain my weight back. So it's been there's a twists of complications that I've had, you know.
Yeah.
So, which, you know, makes it interesting treating people, because people could look at me and go, well, you didn't cure yourself. And I go, yeah, you're right, I didn't shrink the tumor. I mean, and all the therapies I did, you know, from the meditation or whatever, you could look at it that way. And then the other people say, wow, it didn't spread, you're still here.
Absolutely. And you have to look at, like we talked about the other day, the spiritual emotional component of it, and maybe.
Well, I think that's the biggest, personally.
Yeah.
And I've always looked at it as a gift.
Yeah.
So, and I mean that. I remember when I got the colonoscopy, and you know, I came back to the clinic, and you know, I had 6.4 centimeter mass, and I took the staff together, and I go, this is the best thing that could ever happen to me, because I have to change.
Yeah.
And I said, there's no place I'd rather be in the world and around here, and the people love me.
Yeah.
And then we started, you know, and I really mean that, because I know, and I want to emphasize that, as much as I'm, you know, if you look at me from the outside, you might say, well, God, he does all the nutrients, he does all the drugs, he does all of this. It's about changing me to really cure this cancer. So when they took it out, so here's the next part. So you can maybe appreciate that as a clinician, you know, so I'm seeing people for cancer, and everybody knows that I've got it. You know, I'm haven't hidden it, and they're watching my journey, my patients, you know. And then you go, gosh, if I get it out, then they won't believe in me to do any of the other therapies.
Sure.
Because they say, well, you failed, you know, like.
Yeah.
And I go, and that was one of my biggest fears. Like, people go, why are you hanging on? Why are you, I mean, I would get it, even my patients, but, you know, the staff and my family, you know, like, why don't you just get this thing out?
Well, that's why it's called integrative medicine, Kirk. We can use surgery and all the other tools.
Right. and I just said, you know, I had this image that, you know, of having all my scans up on the wall, and patients would come in, and I could show them. I'd say, see, you know, this is the compilation of what I did, and this is the end result. But it didn't happen.
But here you are, and you're alive today. So.
I know. So that's.
So you did something right.
I feel great. And I do. I wouldn't, if somebody said, I know you're going to think that's crazy, but if somebody would said, do you wish you never had cancer, and do you wish that you never did what you did? And I go, no, I'd do it all. I mean, I'd do it again.
No regrets.
No.
That's awesome.
But.
So let's shift gears and talk about chronic pain, treatment of chronic pain syndromes.
Right.
I know that when we spoke, you said that's kind of one of your favorite things to treat, in a sense.
Right. So I won't start with the end result. So what happens, I never set out to treat chronic pain. But from that very first practice that I told you about, where people got off food.
The elimination diet.
Yeah. I saw every joint, every, you know, body pain. I saw every kind of pain improve. 2 weeks on a vegetable puree, but basically you're off your normal food. You could say, well, it's the green slimy drink that did it, but no, you're off
whatever you were triggering. Correct. Because we all had leaky gut.
Right. So, and that would give it a chance to heal as well.
Sure.
So I always tell people, when I do my pain management, you know, I do the shockwave therapy and stuff, it's not the magic. The magic is you want to reduce your load as you're doing the pain management treatment, whatever it is. I don't care any biologic you're doing or injections you're doing. You want to do that first. In my classic experience, I always tell people this, a little blue in the face, but I said, I had an 81-year-old gentleman who came in with bilateral knee pain, and he goes, I play baseball with the guys, I can hit the ball 3 days a week, but I can't run the bases. I have to have somebody run the bases for me. And so I go into my head and I go, well, he may not believe me, but because he wants to do the treatment. And I go, what do you eat for breakfast, lunch, and dinner? And what do you snack on? And what do you drink? I do this 7,000 times a day, exaggerating, but. And he goes, the synopsis was 5 glasses of milk a day and 5 highballs with the boys, you know? And I go, in my mind, I'm not going to get him to change this. He's 81 years old. But I said, can you lay off all dairy products for just 5 days and see what happens to your knees? So I threw in there dairy, and then you got to say cheese, yogurt, ice cream, kefir. You got to say everything from a cow. You say
butter.
Yeah. And then I said, don't eat wheat either. But he wasn't eating a lot of wheat. And so anyway, come back 4 days later and 80% of his pain's gone. Awesome. And I got to tell you, that's over and over and over.
I mean, dairy in particular is super inflammatory, yeah.
And so it's not that I have this thing against dairy or wheat per se. And now eggs are a more common allergen because of the protein thing and stuff. So eggs are good food on paper, but it's a powerful antigen in some people. And so if you're eating, like people are eating 2 or 3 eggs a day, every day, that's somebody I would pull off eggs.
Okay.
Just for 2 weeks.
Try it.
You will know in 2 weeks whether a food's a problem or not.
Sure.
So from that very first experience, that has set with me. The very first experience in 1983, where everybody went on a vegetable puree for a week and I saw all these changes applied to pain management. I always tell people, and even when I'm interviewing for the phone to come in, I say, just do this first.
Yeah.
Okay. And
then you can kind of see what your baseline is from there.
Sure. And then there's a ton of anti-inflammatory nutrients, and if they're not a patient of mine, I say do Relief Factor. You know, it's advertised all over, but it has four different ingredients, and everybody's got 3 of them. They're resveratrol, curcumin, fish oil, and I forget where the other one comes from. It's a little not as common. And so I say do that for 2 months. And to go on an elimination diet.
Yeah.
And just see what happens.
Right.
And that's if they're not coming in and seeing me, and it happens all the time.
Put you out of business a little bit, huh?
Absolutely. But people don't want to hear it's food. They want to be fixed. Even in an integrative medicine.
They want a pill.
Even in integrative medicine, they want to blame traditional medicine because traditional medicine just gave them a bunch of drugs and then spent 5 minutes with them. So I spent an hour with you and you don't want to give up your food. You want to think it's some magical nutrients.
Yeah.
I mean, they can help and they're less toxic, but they aren't going to magically take away stuff.
Still a Band-Aid.
You still have to fundamentally change your diet. Then the gut. So the gut is the most important. It is the gateway. And I always, so one of the freaking things I do in people chronic pain is I will go back and go through each decade of your life and think, what do you do? And so I'm going to ask you about your health. And I'm looking for, did you have chronic earache, sore throats, tonsillitis when you were younger? Were you on rounds of antibiotics? I just had someone just before I left who, it was later in life, but every time he got a bursitis and he had it for 2 years straight, injections, 8 times he got put on antibiotics to treat as he got the injections.
Wow.
I go, that's the trigger. That's the thing that can push you over the balance. So the classic, I'm old school when we treated yeast with nystatin powder and stuff like that. I mean, in the day, the yeast connection by William Crook. But it's true. You take antibiotics. Let's say the classic is a little kid. Eats dairy, quesadillas, wheat, sugar. Creates inflammation in the eustachian tubes. They're at a different angle when you're younger. They're more lateral than down, so they don't drain. You get fluid behind the ears, you get an ear infection.
But it's not bacterial necessarily.
Well, but it becomes that. Yes, so it's serous. It's serous first, but once it closes off, eventually, if you have no air in there, you can get a bacterial infection. So then you get treated with the antibiotics, so it clears up, and they go, great. They keep eating the same food. So then you give another round of antibiotic. You've changed the gastrointestinal flora a little bit, and I give the analogy of if you shot all the wolves in the forest, all the deer would go around and eat everything up because they would grow and they would destroy all of...
And then you've got candida.
Right. So that's the history I'm looking for, because if I get that history early, and this relates to other things, let's say somebody has that and they grow out of it because their eustachian tube changes, and then they get tetracycline for acne. I always ask that one. Like, did you ever get like acne and tetracycline? Oh, yeah, I did. And then you go a little bit later in their 20s and 30s, I had chronic bladder infection. So I'm looking for that time or multiple times where they are really changing their gastrointestinal flora. Now, if you did that and ate a clean diet, not a bunch of sugar and such, it might not be a problem. Or took probiotics, go, gosh, I just had this, antibiotics, and I take the probiotics and then I stop eating sugar. But they don't. And so those people's immune system keeps getting hammered over time, And they're the ones that get an autoimmune illness later on in life, and they're still on the foods. So they're still on the dairy, the wheat, and the eggs, and the sugar, and now maybe they're throwing in alcohol because they're an adult. And so that is what I really dig on. When I do a pain management history, people go, what are you doing? Why are you asking me about my childhood ear infections? Because that's setting you up. So, intestinal permeability. I give the sieve analogy, when you're sifting flour. Okay, so beautiful flour comes through. That's the way your gut should be. It lets the nutrients in, keeps the bad stuff out. But when you do antibiotics or a chemical insult, it's like taking a little knife and putting little holes in it. When you squeeze it, this big chunk comes out. Well, that chunk inflames your immune system. Okay, it triggers, it could be immune complex on a microscopic level. And then you're chronically getting insulted. And that leads to pain. It could be fibromyalgia, it could be whatever. So that's why fasting has done so well with people, like the Prolon, the fasting mimicking diet, or putting people on elimination diets. I mean, ideally, there's a fasting clinic called True North in Santa Rosa. They've done more water fasts than anybody, like 25,000 or something like that.
Like medically supervised.
Okay. I just had this patient come back again today, and she had perfect example. She wanted me to do the shockwave therapy for plantar fasciitis, which is the gold standard. I mean, podiatrists love this machine for that. And I said, what are you eating? Because I know this person because she had chronic back pain before and tail pain, and she went there. I convinced her to go, and it went away. And she was, medical, legal stuff, all kinds of stuff. And I remember that, and she eventually said, yeah, I got back on dairy, and she admitted, and then she went back, So a water fast is the ultimate. Because if you clear up on a water fast, two things. It's either the food or your gut healed itself in that.
And it's free. Doesn't cost anything to do that.
If you can do it by yourself. So when you go to the clinic, they follow you and stuff like that. But it's hard for people to do water fast. But yes, ultimately, if you have pain and you can stay at home and do a nice water fast.
For how long would you do it?
You only need to find out about pain if it's going to make a dent in it. 4 to 7 days. I always try and get.
It's a long time for most people.
Right. It is. It's not going to happen. And I mean, every once in a while you get like a dairyaholic, that you get them off dairy and in 2 days they go, oh my God, but that doesn't happen all the time. So I would say that, when I talk about pain, and people don't want to hear that because they just want a treatment to fix their pain. You know what I mean? Yeah. And they're going, diet? Really?
So boring, Kirk.
Yeah, why are you talking to me about diet?
Can't you do like PRP or shockwave, something fancy?
But the flip side is, so practitioners who do it because they're trying to make a living, they can't spend time yapping about diet.
Yeah.
Well,
then they're gonna cannibalize their business.
Correct. I didn't say that. You said that. But I'm just saying, so maybe I could be more successful, but I don't know. But that's what I try and do for pain management.
Well, thanks, Kirk, for being here. You're a wealth of information. And can you please tell our listeners where they can find you online and in person?
Yeah. Love to. So online, I have a Substack called stayinghealthytoday.substack.com.
Okay.
And
that's like a newsletter, and you're going to have podcasts.
Videos, and I'm going to have podcasts again.
Okay.
I'm redoing that again. And then I see patients every day.
Okay.
And that's at health. Well, actually, no, I'm trying to change my life to be less stressful, so we'll see how I do. But I'm trying to work just Monday through Wednesday and then give my writing and Substack the rest of the time.
Okay.
But I'm working today and tomorrow. So that's at Health Associates Medical Group.
In Sacramento.
Yeah. And it's near Health Arden Professional Drive, 916-489-4400. You call. You can talk to Dr. Quaker. He has an open phone line 8 to 9. What I do is if you call for me, I call them back. Okay. And then I go over it with them because I want you to
do a pre-consultation.
I want people to fit in the practice. It's not about getting more people. It's like if you're not a fit, because I have a different style, you know, and so I want to make sure people are happy before they come in. And then the website is Quaker, Kwiker, not quicker, QuakerMedical.com.
Perfect.
And I had a great time.
Great. We'll come see you.
Okay.
Thank you.